Our world has changed. 9 months ago in Lyon, France, we were celebrating the success of the Global Fund's successful replenishment. $14 billion, not just the largest ever fundraising for the Global Fund, but the largest ever fundraising in global health. This success meant we could increase country allocations for the next 3-year grant cycle by 23.4%, with, as always, 50% of the money going to the fight against HIV. So we entered 2020 excited at the prospect of stepping up the fight, getting back on track towards ending the epidemic by 2030, scaling up prevention programs, reinforcing differentiated service provision, tackling human rights related barriers to access, accelerating the rollout of innovative approaches such as self-testing and PrEP. I was preparing to come to AIDS 2020 with an ambitious and optimistic analysis of what we needed to do to meet our 2030 goals for HIV and break the back of the AIDS pandemic. And then came COVID-19, and everything changed. In the same way that AIDS changed the world of global health some decades ago, COVID-19 is changing it now. We, the HIV/AIDS community, were the innovators and shapers, pioneering through community-led activism, breaking new ground in how science and communities interact, tackling the stigma and marginalization that drove and still drives the epidemic, mobilizing resources on a scale the world hadn't seen before to respond to the pandemic. The last pandemic to strike humanity before the short-lived H1N1 and now COVID-19. The Global Fund was a product of that extraordinary moment of global solidarity, that burst of energy and leadership, a unique global private-public partnership to fight HIV, to fight TB and to fight malaria, the 3 biggest infectious disease killers. Now, with the fight against HIV as yet unfinished, we've been confronted by a new pandemic. The direct impact of COVID-19 is scary enough. In the first 6 months of 2020, COVID-19 has killed over 500,000 people across the world. That's more, maybe a third more, than the number that we would have expected to see die from HIV and AIDS over the same period. But making it worse is the knock-on impact. COVID-19 is derailing the fight against HIV in multiple ways. By disrupting HIV-positive people's access to life-saving antiretroviral treatment. By disrupting prevention and testing programs. By attacking people who are already immunocompromised. By exacerbating the poverty and exclusion of the key populations most vulnerable to HIV. You'll have seen the analyses from UNAIDS and others on the potential effect of COVID-19 on deaths from HIV and other diseases. We could see deaths from HIV and AIDS in sub-Saharan Africa double over the next 12 months. That would take us back to the level of deaths last seen in 2008, 12 years ago. All that extraordinary effort wasted, all those lives, all those billions of dollars, this would be a disaster. We cannot let that happen. We must protect the gains we have made. We must continue to step up the fight. There's too much at stake. It's not just the hundreds of thousands of lives we might lose over the next 12 months. It's the many more lives we would lose, families we would see destroyed, communities ravaged over the years to follow. In the fight against HIV, every step is hard won. We cannot go backwards. The longer-term consequences become starkly evident when you consider, as just one example, the potential impact of disruption to prevention of mother-to-child transmission programs. Analysis by the HIV Modelling Consortium suggests that the ending of PMTCT activities could see the number of new child infections increase by 37% in Mozambique, 78% in Malawi, 104% in Uganda. Other analyses suggest interruption of prevention programs could see new infections spike by 25%. To be able to counter this potentially catastrophic knock-on impact from COVID-19, we must know what's happening on the ground. At the Global Fund, we draw on multiple sources, including our own monitoring tool, a bi-weekly qualitative survey covering over 100 countries in which the Global Fund invests. The latest results, dating from the 15th of June, suggest 80% of the HIV programs we support are suffering disruption, of which 21% are suffering high or very high levels of disruption. What's happening in Zimbabwe illustrates what such disruption means in practice. Data from a recent survey reveals 19% of people on ART are unable to get a complete ARV refill, a 21% decline in HIV testing in the first quarter, and then a 70% further reduction during lockdown, a 78% reduction in PrEP initiations. This is Zimbabwe, a country with one of the most well-run, effective and successful HIV/AIDS programs in Africa. The Global Fund has reacted swiftly to support countries and communities in responding to these challenges. At the beginning of March, we introduced grant flexibilities to enable countries to utilize funds from grant savings and reprogramming. In April, we launched the COVID-19 response mechanism, known as C19RM. In total, we have made up to $1 billion available. So far, 96 countries and 8 regional programs have used $369 million across these two mechanisms. Our support is focused on 4 areas: helping countries and communities adapt HIV, TB and malaria programs to mitigate the impact of COVID-19 and to safeguard progress; helping protect frontline health workers through providing personal protective equipment and training; reinforcing systems for health so they don't collapse; and helping countries fight COVID-19 itself. All 4 elements are crucial to protecting the gains and sustaining the momentum in the fight against HIV. HIV prevention, testing and treatment programs need urgent redesign, including changing treatment distribution models, shifting to multi-month dispensing and direct delivery of ARVs to minimize exposure to infection, adopting digital solutions for service delivery, reducing dependence on face-to-face interaction, expanding self-testing and community-based testing. Frontline workers, including community volunteers serving key populations, must get protective equipment and training. We cannot afford to lose them. We cannot let them become unwitting vectors of transmission. Weaknesses in health systems need urgent fixing. For example, laboratories already overstretched with viral load testing and TB diagnosis are now being swamped with COVID-19 testing. And it's the viral load and TB testing that's getting squeezed out. Containing the spread of COVID-19 is key to avoiding the whole health system being overwhelmed, which would be disastrous to those with HIV. One positive is the extraordinary innovation, courage and creativity we're seeing, particularly in community-led responses. Whether it's 100% life in the Ukraine, using courier services to deliver ARVs to people living with HIV, or Roots Africa in Zimbabwe, ensuring the most vulnerable, including women and girls living with disabilities, get food alongside their ARVs, or BHESP in Kenya, supporting sex workers with food, hygiene kits and condoms. We're supporting our civil society partners as they swap ideas, implement best practices, accelerate the adoption of new tools such as self-testing and online consultations. We should recognize and ensure others see how much the COVID-19 response depends on the infrastructure and capabilities put in place to fight HIV, such as molecular diagnostic instruments for viral load testing and TB diagnosis now being used for COVID-19 tests, or community health workers now leading COVID-19 containment efforts in their own communities. We should also be alert to and make visible the dark side of lockdowns and other measures to contain COVID-19. We've seen shocking increases in gender-based violence. We've seen public health measures distorted and exploited by those who are looking to reinforce or reinstall human rights-related barriers to health, fueling stigma and discrimination against key populations. We've seen significant interruptions to programs intended to protect young women and girls from HIV infection, setting back efforts that should be scaling up. We must ensure that in the fight against COVID-19, as much as in the fight against HIV, we leave no one behind. I am proud of the way the Global Fund Partnership has responded to COVID-19. From frontline workers, national AIDS programs, our technical and other partners such as UNAIDS and PEPFAR, and the board of the Global Fund in supporting the rapid release of up to $1 billion in funding to support countries and communities in adapting their HIV, TB and malaria programs and fighting the new virus. But I am also conscious that this is only the beginning. In many of the countries most affected by HIV, we are only at the early stages of the COVID-19 pandemic. So 2 weeks ago, the Global Fund released a report on mitigating the impact of COVID-19 on countries affected by HIV, TB and malaria. This report has 3 key messages. First, in the countries most affected by HIV, TB and malaria, the knock-on impact of COVID-19 could be even greater than the direct impact. In other words, more people could die of other diseases as a result of the pandemic than because of the new virus itself. This means that strategies to fight COVID-19 should be designed to minimize the total loss of life, not just the deaths from those testing positive to COVID-19. Second, mounting an effective response to COVID-19, including mitigating the impact on HIV, TB and malaria, will require significantly more money than has currently been made available. We estimate that in the countries in which the Global Fund invests, an extra $28.5 billion is required. Moreover, the devastating impact of COVID-19 on low and middle income country economies and tax revenues means that most of this extra money will have to come from external partners. And finally, we reckon the Global Fund can and should play a significant role in delivering this response. Why us? Well, the Global Fund is the world's answer to fighting devastating infectious diseases. As a partnership, we're unique, combining governments, civil society, the private sector, technical and development partners to prevent, treat and defeat disease. Moreover, given our history and mandate, the Global Fund is uniquely placed to ensure the response to COVID-19 leverages the capabilities and lessons from the fight against HIV, and we're also best placed to ensure the way the fight is fought mitigates the impact on HIV. However, to play this role, we will need more money. Not the full $28.5 billion, but as we say in the report, we could and should invest an extra $5 billion in the next 12 months. With such resources, we could save millions of lives and minimize the reverses that otherwise look inevitable. But what role or resources the Global Fund plays or has in the next phase of responding to the pandemic is simply a subset of a much bigger question for all of us. How do we position the unfinished fight against HIV? And how do we ensure we secure the resources to finish the fight in a world where political attention, donor priorities, and the global agenda are almost certainly going to revolve around COVID-19 for the next few years at least. Because this is the reality, and it's both a risk and an opportunity for us as a community. My view is that the HIV community must lean into the COVID-19 crisis, sharing what we've learned, leveraging our capabilities, lending our voices in advocacy, using our unrivaled collective understanding of what it takes to defeat a pandemic. We don't want the fight against HIV to be competing for attention and resources with the fight against COVID-19. Not when it's a competition we would probably lose. Not when, ultimately, it'll be the same people, the poor and the marginalized, who are most at risk from both viruses. Not when the fights are best fought as one fight, simultaneously tackling these two formidable adversaries. While no one can be sure how this global health crisis will unfold, and there are many scenarios, I've been thinking about two in particular. One scenario where the rich parts of the world succeed in controlling and containing COVID-19, effectively eliminating it as a public health threat, but the virus still persists and kills large numbers of people in the poorest countries and among marginalized communities. In other words, the fight against COVID-19 follows roughly the same path as the earlier still unfinished fights against HIV and TB, becoming in a sense a residual pandemic, no longer thought of as a global health security issue, a fight where we have left people behind. That would be a nightmare. And it's not implausible that this could happen. But there's also a much better scenario, where the COVID-19 crisis becomes the catalyst to reframe and re-energize the fight against HIV, where the whole idea of a residual pandemic becomes unacceptable, where we truly commit to leaving no one behind, whether to HIV, COVID-19, TB, or malaria. To get here, we have to demonstrate that this is all one and the same fight, that the battle against infectious disease is not just a battle against one particular virus, but a commitment to make everyone safe. That it's about finishing the fights we haven't yet won against HIV, TB, and malaria. That it's about winning the new fight against COVID-19. That it's about preparing ourselves for fights against pathogens as yet unseen. And above all, that it's about leaving no one behind. So for all of us, people engaged in the fight against HIV, I see three big tasks. First, we must, right now, secure the resources and take the action required to minimize the knock-on impact of COVID-19. That'll take much more money than has been committed thus far, and it'll take extraordinary imagination, collaboration, innovation, and leadership. Second, we must use our voice, experience, and expertise to ensure the response to COVID-19 is people-centered, rights-based, and focuses on the poorest and most vulnerable. So far, most countries' responses to the pandemic have been largely technocratic, top-down, and haven't done enough to help those most likely to get infected or die. Yet we know, from our own story and struggles, that unless we unleash the power of communities, that unless we commit to leaving no one behind, that unless we think in terms of people, their rights, and the lives of those least visible, that we will not succeed. Against infectious diseases as formidable as HIV and COVID-19, no one is safe until everyone is safe. And finally, we must ensure that the strategic rethinking of global health that this crisis will undoubtedly trigger doesn't push the fight against HIV further down the queue for talent and resources, but lifts the ambition across all infectious diseases so that not only can we defeat COVID-19, but we can accelerate victory against HIV, building an approach to health across our world that is strong, resilient, and leaves no one behind. To be successful in completing these tasks, we must act with speed and conviction, and we must act together. We must unite to fight.